1985. I'm running an adolescent program affiliated with Emory University. I've been a faculty member there for 40 years now. And I'm running this adolescent program, and I realize in 1985, after being there 5 years, that half of my adolescents are doing drugs and alcohol, and I didn't know anything about it. Never heard anything about drugs and alcohol in my training or in my child psychiatric fellowship. So I then began to read, found out we didn't know much about adolescents, drugs and alcohol at this point. Not that we know a great deal even now, but at any rate, I then hired a recovering counselor, ran a group with him. He and I ran a group every day, 5 days a week for 4 years. And that's where I began to learn, set up an adolescent substance abuse program, and then have continued on for the next, 25 years in the field, developing workbooks. How do you make 12-step treatment meaningful for adolescents? How do we intervene with them? What is treatment all about? Absolutely, and they're using harder and harder drugs. We know now that historically, when I interview teenagers, many of them begin smoking marijuana at ages 9 and 10. And of course, the marijuana now is 10 times stronger than it was 5 and 10 years ago. By the time they're 12, 13, 14, they're doing benzos, they're doing Oxycontins, they're drinking heavily, and then many of them are going on to cocaine, crystal meth, and even snorting Oxycontins and even heroin by the time they're 17 and 18. So we're seeing an escalation of the severity of drug usage, abuse, and then dependency and problems with it, and kids are using at earlier and earlier ages. And we know from studies that the earlier they use, the worse their substance abuse and complications of that are going to be. Youngest narcotic addict is probably 16. This was addicted to heroin at age 16, had moved on, started about using, they usually begin with alcohol and marijuana, and cigarettes, of course. Cigarettes is how you learn how to inhale, move on to marijuana, because the teenagers see this as a benign drug and it's being legalized, so it must be good for you, all of that propaganda. They then move on to pills, and then those that like the opiates and like the benzos can move on, even at age 16, to shooting up heroin. Well, if we're talking about a full-blown severe teenage drug addict, say at age 15 or 16, often detox may be needed, especially if they're physically dependent on benzodiazepines, Ativans, Xanibars, Klonopins, Valiums, tremendous amount of benzo use, and it's very dangerous and risky because if they become physically dependent, they can suddenly stop and later have a seizure and die. So I've trained my staff to ask specifically, and a lot of concern about, I don't want to miss that. We've had a couple of kids that have they've been caught using drugs, stopped their benzos, and had a seizure. In terms of how long, it's individualized. If they need to be actually detoxed, like if they're benzo physically dependent. Otherwise, we have a very active, enthusiastic sobriety intensive outpatient program, which, although it's 4 hours a day, 5 days a week, but they hang out together. We provide social activities, high stimulus social activities, all throughout the weekend. And that's a program that will go on usually for 2 to 3 months, and then aftercare at our own groups and continued with social activities. Also, there's a parent component weekly. When that will do for 2 years, and then hopefully they move on to AA and NA. So if they're truly an addict, or in the new DSM-5, severe substance use disorder, if they're truly an addict, it's going to be a lifetime process. It's been 31 years since I had a cigarette, and I will give my right arm for a pack of cigarettes right now. And it's been 31 years, and I still will have using thoughts and feelings. So I need to be in recovery from my nicotine addiction for the rest of my life. We know that the longer the teenagers are in treatment, the better they will do. The field is such, and many of the studies were 2 to 3 months of treatment, and then there's only 30 or 40% in recovery at a year later. We've learned that you must continue treatment. You can't just treat them intensely and often they go back to their using peers and they begin to use. But you need continuing care, continuing treatment for a period of at least a couple of years. Big danger that I've seen more recently is we get a kid clean and sober for, say, 2 years, and then he goes off to college. And he goes off to college, and unless he's set up to be in many universities now have recovery programs, they have a recovery dorm where they don't use drugs and alcohol, or they have AA and NA groups in the college. If they don't set up to do that, they're thrust in, oh, I'm fine now, I've been 2 years clean and sober, I'm not an addict, I can use in moderation. And they start drinking, and before you know it, they're back shooting heroin, and they often have moved on to harder, into heroin, IV, that epidemic of IV heroin addiction that we're seeing. Well, that's a tough question. When do we treat it? And often we don't. The view is that if they're going to smoke, it's not worth getting into a fight over nicotine. Cigarettes don't kill teenagers. They kill adults. They'll kill me if I was still using. We know they cause heart disease, lung cancer, high blood pressure, all the complications. But these are with teenagers who are high stimulus seeking, unless at some point they decide we don't allow smoking in our programs and in where we do our groups and where we even have our social activities. But a huge number of them will smoke cigarettes, and at some point, hopefully, they'll decide not only is it bad for me, but it smells bad, blah, blah, blah. We have a problem now with the whole issue of electronics, vaporizing. The electronic cigarettes is coming on the market now, which is doesn't have all the tar, but it's just like pure nicotine. So it's a tough question. When do we treat it? When the teenager decides he wants to stop. And then having used Nicorette gum for 6 months for my nicotine addiction, we'll use gum, we'll use the patch, we'll use some of the other pharmacological agents. But usually it's not until young adulthood. If they start smoking at 14 and 15 and 16, it's the least of our problems, because nicotine doesn't impair driving. Nicotine happens to be, except for it causes cancer and can kill you, it's a wonderful drug. It stimulates low levels in your serum. It's a stimulant, and high levels, like after lunch, it becomes a tranquilizer. The main issue is it's not illegal, and it doesn't impair driving. So we really don't approach it as that this is something that needs to be part of your abstinence. We approach it as we will, when the teenager says, hey, I want to stop, we will help him stop.